I'm Dr. Eva Pressman. I'm a proud recipient of the CTSI Pilot grant for our study entitled Vitamin D Dynamics in Pregnant and Non-Pregnant Women. This study is done in collaboration with faculty in the Division of Nutrition at Cornell University in Ithaca, New York. I've been collaborating with Dr. Kimberly O'Brien for over 10 years. When she started her research here at Cornell, she realized that she needed access to a clinical population that was hard to obtain in Ithaca, New York. So we began to work together on the pregnant population here in Rochester. So the study that we're doing as part of this CTSI pilot grant is really the first of its kind, looking at how vitamin D is metabolized both during pregnancy and outside of pregnancy. Very little is known about how the vitamin D is absorbed and how it's processed through both the mother and the placenta and into the fetus. And vitamin D is felt to be a very important nutrient regarding many complications of pregnancy, such as preeclampsia and inflammation and infectious diseases. This study looks at a deuterated form of vitamin D and how it is metabolized in women, both during and outside of pregnancy. It will follow the vitamin D as it's absorbed by both the patient and the fetus, and how it gets into the umbilical cord blood as well. A deuterated form of vitamin D has a heavy form of hydrogen, which is a naturally occurring substance, but we use it in a concentrated form so that we can trace the vitamin D that we give to our patients during the course of pregnancy and delivery. We're planning to enroll 10 pregnant and 10 non-pregnant women. We're going to obtain all the same blood samples in both sets, but for the pregnant women, we'll also get cord blood at delivery. Because we want to trace the vitamin D through the mother and to the baby for our pregnant subjects, we're going to recruit women in the third trimester of pregnancy, between 32 and 35 weeks. That way, we can follow them over the course of the last remaining weeks of the pregnancy and into the cord blood sample when they deliver. So the women will mostly come from the Rochester area. We will recruit them from our own OBGYN clinics as well as from the university as a whole. For the pregnant women, they will all deliver here at Strong Memorial Hospital so that we'll have access to the cord blood samples at delivery. The patients come into the clinical research center and receive a specific amount of this deuterated vitamin D with a breakfast meal, and then have blood samples drawn every few hours over the course of about 7 hours. We then repeat those blood samples at several day intervals for about 3 weeks to see how much of the vitamin D gets into the fetal circulation. The samples will be analyzed not only for the deuterated vitamin D, but also for other substances that affect vitamin D homeostasis, calcium and other hormones that affect absorption of vitamin D and calcium. Because we were awarded the CTSI Pilot Award, we're able to use the Clinical Research Center here in a way that's really beneficial to the study. It's rather challenging to obtain blood samples over the course of 7 hours without a center like the CRC.